Heart 9, at the radial nail point of the little finger. I'm going to feel for the flare. Look at where the proximal and radial borders meet. Look at where the nail bed is and put my point in.
Heart A is on the palmar aspect of the hand in a dip between the heads of the 4th and 5th metacarpals, typically where the tip of the little finger rests when a loose fist is made. To find lung 10, find the midpoint of the shaft of the 1st metacarpal and go in between that point and the muscle of the thenar eminence.
Heart 7, which is at the flexor aspect of the wrist joint, at the proximal border of the pisiform bone, the radial to this flexor carpi ulnaris tendon. In order to bring this tendon into relief, if you get the patient to put their thumb and their little finger together, that will bring that tendon up. And just relax. Articulate the wrist and pop your point in. Heart 5 is on the flexor aspect of the forearm. It's 1 sun proximal to heart 7, on the radial side of this flexor carpi ulnaris. Pericardium 6 is on the flexor aspect of the forearm. It's 2 sun proximal from pericardium 7, and it's in between the 2 tendons palmaris longus and flexor carpi radialis. Lung 4 is 4 sun inferior to the anterior axillary crease, between the lateral borders of biceps brachii and the shaft of the humerus. Pericardium 2 is 2 sun inferior to the anterior axillary crease, in between the 2 heads of biceps brachii. If you pinch the muscle up either side and put your finger in between the 2 heads, that will be where pericardium 2 is.
Spleen 4 is located in a depression which is distal and inferior to the flare of the base of the 1st metatarsal. Feel along the inferior border of the 1st metatarsal, find the flare of the base and place your point in between that flare and muscle. Spleen 4 is about 1 sun proximal to spleen 3. Be careful when palpating along the inferior border of the metatarsal that you don't overshoot the head and find this nice dip in between the medial cuneiform bone and the base of the metatarsal. It's a nice dip, but it's not spleen 4. Kidney 6 is located 1 sun directly inferior to the prominence of the medial malleolus. Palpate down 1 cun and feel for a cleft in between 2 tendons. Kidney 6 lies in that cleft. A common mistake is to palpate down only half a cun and to try to locate this point in the ankle joint. It's not in the ankle joint, it's in the cleft between the 2 tendons that are inferior to it. Kidney 4 is located in relation to kidney 3 and kidney 5. Imagine a line joining kidney 3 to kidney 5. Come halfway down that line and move posteriorly to mark your point just off the anterior border of the tendocalcaneus. Spleen 6 is located 3 cun superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. Liver 5 is located 5 cun superior to the prominence of the medial malleolus, immediately posterior to the medial crest of the tibia. Mark this point in between the medial crest of the tibia and the gastrocnemius muscle. There's often a nice notch in the bone just at this level. Stomach 36 is located approximately 13 cun superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cun inferior to the inferior border of the patella.
Ren 17 is on the anterior midline, level with the 4th intercostal space. Ren 14 is 6 cun superior to the centre of the umbilicus, on the midline. Ren 12 is 4 cun superior to the centre of the umbilicus, on the midline. Ren 6 is on the lower abdomen, on the midline, 3.5 cun superior to the symphysis pubis.
Gallbladder 19 is on the curved line joining gallbladder 15 to gallbladder 20, and it's on the same level as DO 17. DO 24 is located on the anterior midline, midway between DO 23 and the anterior hairline.